Welcome to this session, which is part 4 of the webinar series on understanding self-harm and suicide. I'm Dr. Krisha Patel, and I'm the mental health lead for the company. This session is going to mostly focus on how we talk to clients with mental health problems. So thinking about our approach, what questions to ask, and how to start the conversation, and remembering that they may never have spoken about their suicidal thoughts to anyone before. So talking about self-harm. Your approach can make a massive difference to the client. We need to be aware of our unconscious bias. Many people feel anxious talking to clients with mental health problems or talking to people about their self-harm. Healthcare practitioners may feel inexperienced and they may feel anxious because they don't know how to broach the subject or are worried that they are going to worsen their suicidal thoughts just by asking them, which is not true at all. So your approach can make a massive difference to the client, and we need to be aware of our approach. Some people may really hate talking about mental health problems, and some people may find it quite comfortable to talk about them. So being aware of ourselves in that situation is really important to understanding our approach to the client. We should always be calm and non-judgmental as much as we can be. Take a validating approach. And what that means is ensuring the person feels that they have been fully heard. So validation is a key strategy when helping people with self-harm thoughts and self-harm behavior. So validation doesn't mean you are approving of the self-harm behavior. So if they've cut their risks and that's their coping strategy, by giving some validation, what you're doing is acknowledging that they're in distress and making sure that person feels fully heard. Take the time to understand the situation and the emotions that have led to the self-harm. Don't focus on the self-harm part on its own or jump to solutions. So again, that's all about making sure the person feels fully heard. Far too often, people just focus on the self-harm risk assessment and focus on solutions and providing advice, when really sometimes all that person needs is to vent and let out their emotions and to feel like they've been understood and listened to. And finally, take all self-harm seriously. So as healthcare practitioners, we all know taking 4 paracetamol with some alcohol is not a lethal suicidal attempt. However, if somebody does take 4 paracetamol with alcohol, it's important to take that self-harm or suicidal attempt seriously, because for that patient, they may have believed that was enough to end their lives. And we need to address all self-harm because, as we know, previous self-harm is one of the biggest risk factors, or one of the main risk factors, for completed suicide. So asking about self-harm behavior, I've just given you an example of cutting wrists, so superficial laceration to the wrist with a knife. So if I'm seeing a client who's presented to me with having cut their wrists, what I want to know is what is the motivation behind that self-harm. I've talked about it in a different webinar that people self-harm for different reasons. Sometimes it's with true suicidal intent, and sometimes it's not within suicidal intent, and more of an expression of their emotional distress. So it's important when we're assessing the client in front of us to really think about and explore that motivation. And we can do that by asking questions like, how did you feel before self-harming? What were the thoughts going through your head before you self-harmed? Why did you self-harm? And how did you feel after self-harming? Did you feel better? Did you feel worse? Did you feel shame, guilt, regret? Asking about self-harm and suicidal thoughts. I'd like you to write down 5 or 6 questions you would ask someone about their self-harm or suicidal thoughts. Let's say somebody has presented to you with suicidal thoughts. What kind of questions would you ask? So I want you to pause the video, write down your thoughts. If you're working in small groups, discuss this amongst yourselves. So I think it's helpful to think about suicidal thoughts as a spectrum. On one end of the spectrum, someone may have fleeting suicidal thoughts that are rapidly dismissed. They may fear those suicidal thoughts and they don't have any plans to act on them at all. They may have some passive thoughts of not wanting to live anymore. On the other end of the spectrum, you could have someone with active suicidal thoughts that are constant and worsening and becoming more frequent. They may be becoming more intense. They may have thought about suicide for a while and made some plans or preparations to end their life. So they may have bought a rope, stockpiled medications. They may have made a will or settled their financial affairs. They may have a strong desire for suicide. And between this spectrum, someone with suicidal thoughts can lie anywhere along this spectrum. So we need to think about suicidal thoughts as being on this spectrum. And it's not just about presence or absence of suicidal thoughts. It's not just a yes/no question. We need to explore it in more detail to find out what the client actually means when they're saying they've got suicidal thoughts. So we want to know if they are worsening. Are they getting more severe? Are they getting more frequent? Are they stable or worsening to suggest a deterioration? There are many people who will describe a long history of suicidal thoughts, but if they are worsening, that may suggest a deterioration in their mental health. You might want to ask them, how do they feel about the future? This is a good question because if somebody is future oriented, and by that I mean they're looking forward to things in the future. So they may say, I'm looking forward to see my granddaughter in a week. I'm looking forward to my birthday next month. Being future oriented is a protective factor. On the other end, if somebody feels absolutely hopeless about their future, they see no future in themselves, they see nothing, or they can't even think about their future. It's so difficult getting past today that they cannot think about the future, and they are hopeless that their situation won't change. That is a risk factor for suicide. So thinking about how to start conversations about self-harm and suicide, and remembering that we always need to ask about self-harm and suicide when we're considering our risk assessment for anyone with a mental health problem. A gentle question to start the conversation is, have you ever thought life is not worth living? Have you ever wished you could go to bed and not wake up? Someone who says they wish they could go to bed and not wake up, but they'd never do anything to end their lives, is someone who may have a passive death wish. And then we could ask a bit more about suicidal thoughts being more active. So have you thought about ending your life? Have you made any plans, any preparations, completed any final acts? So have you researched how to end your life? What kind of methods have you thought of? Have they done anything like settle a will or settle their financial affairs? And this is thinking more about those active suicidal thoughts. Have you ever tried to hurt yourself before? One of the main risk factors for suicide is previous self-harm history. Are those attempts also escalating? Have they recently tried to hurt themselves and it was a recent failed attempt, but do they have that ongoing intent to do it again? Are they hopeless about their situation? Do they perceive themselves to be a burden? And I'd refer back to that interpersonal model of suicide in the previous webinar, which gave a good explanation of why these are key things to consider when considering the risk of suicide. So the latest Royal College of Psychiatry report on self-harm and suicide, which was published within the last year, has said and made a key point of considering someone's online use as well in their risk assessment. So taken directly from the report, the online world, especially social media, has a significant effect on the person at increased risk of suicide. All mental health professionals should recognize this, consider engagement with their patient's digital life, and include it within their clinical assessment, especially where self-harm is identified as a possible factor. Some will find this easier than others. So what we need to do is ask our clients how they're using social media to see if they're using websites that are pro-suicide, to see how they're using social media sites like Instagram and whether they're having a detrimental effect on someone's mental health. So just to summarize that session, we briefly talked about some of the questions you can ask someone who has had suicidal thoughts or suicidal behavior. We also talked about the importance of considering the online world as well. In the next session, we're going to talk about suicide and self-harm risk assessments, considering how and why we do them, and whether there's any validated tool that can actually predict suicide.